morning. We're going to do recap because I've been asked to kind of present things a little simpler. Many people said when they looked at the congregation yesterday, they looked like the deer in the headlight. I don't know what that means, but
It means this. Go ahead, you're good.
I'm good? I can start? Okay. So originally, man was without sin. When man sinned, something happened. I believe one of the things that happened is that our genetic code began to change. Virus is one of those mobile genetic elements that can insert itself into the genetic code and change it. I believe that's partly what Satan did when man surrendered to sin, to Satan. When that happened, if you remember, back in Genesis, man lived up to 900 years old, okay? Now, either that is a total fable or there's something that we don't know about. There's a lot of information that it may have been the atmosphere. We may have had more atmospheric pressure. If we had more atmospheric pressure, the oxygen would have been higher. That may be why if you go in a hyperbaric chamber that people know about now, it improves your health. That may be why ozone works. You've heard of some of those treatments, okay? But I think that the genetic code has a lot to do with that. That's why this Human Genome Project has been so exciting, is because we're actually beginning to see a link between disease and genetics. Now, that doesn't mean that you're always going to have a problem just because you have a gene that's wrong. Because as you've heard over and over again, we know that, who was it at Weimar? Milton Crane, was it originally? Who said that genetics is the gun, but lifestyle pulls the trigger, okay? So just because you have the gene doesn't mean it's going to be a problem. But I know that in Adventist circles, where people are eating a total plant-based diet, we still have disease. So what can we do about that? Well, this may be one of those avenues where if you have that gene and the gene is turned on, we may be able to do something about it by using proper nutrition. So in medical circles, as I mentioned yesterday, a lot of people, especially professionals, doctors, believe that vitamins and nutritionals are just a waste of money. I was in that camp for many years. I am no longer in that camp. Even if you're eating a totally organic diet, which we know has far more nutrition than the non-organic, do you realize that the nutrition in organic foods has gone down like 30% in the last 10 years? It's stunning. So if you're not getting it in your food, which you're using as let thy food be thy medicine, where are you getting it? So there are several tests that I've done in my office. You can do a blood test as you do a standard test through the hospital, and you do a B12 and a folate level. Those are the B vitamins. And at the same time, with the same blood, you can send a tube to a lab called SpectraCell, and you can see a B12 level very, very high in that hospital lab, and yet if you look at SpectraCell, which tests what's in the cell itself, it's very low. So we can do that. I've done that on a number of patients, enough to know it's expensive, enough to assure myself that I'm actually on the right track on this stuff. So that's what we're talking about with nutritional deficiencies. B vitamins, you recognize, are water soluble. Water and oil don't mix. They do nothing in water-soluble compartments. They do nothing in the blood. You can test your blood, you can see all your levels, and your doctor can say you're fine. It's not true. You may or may not be fine. Okay? So you have to, because a B vitamin works in a cell, it's got to get into a cell. Now, God made it so that there's enzyme systems that change those water-soluble B vitamins to fat-soluble forms. Those are the things that are connected with these genes. When that gene's turned on, frequently those do not work as well. If we look at those genes, particularly those two, the 1298, 677, which they're now changing the names of, by the way, just to confuse you. If you look at those primary genes, depending on whether you have two genes, homozygous, or one gene, heterozygous, we can pretty much predict when they're turned on how much reduction in B vitamin efficiency you're getting. Okay? So the B vitamins work in over 250 different systems of the body. If they're not working well, your entire body is affected. That means all kinds of things. That doesn't mean just that you have one sore knee. You may have the entire body affected. And that's why it's very hard for a doctor to say, okay, what is this? What's the cause? We've got to call it something. After all, we're educated, we're sophisticated. We're the experts. So we're going to call it something, right? So we start naming it after these syndromes. We start naming it after chronic fatigue. What kind of a name is that, okay? Metabolic syndrome, another one, okay? Which is a way for us to put a handle around things so we know what we're dealing with, but we really don't know what we're dealing with, okay? And I see several of my doctor colleagues out here, and I'm stepping on eggs, okay? But really, now that I'm no longer young, see, when I was young, I listened to my elders. You're supposed to. Now that I'm kind of getting there, I'm saying, hey, maybe we ought to change this dialogue a little bit, okay? So that's what we do in these neuroimmune syndromes. We try to see, do we have a genetic abnormality? As I said, there's about 50 SNPs, these single nucleotide polymorphisms that are in the genes, including you can have a blocking antibody to vitamin D. So your vitamin D is doing nothing. Now, why is that important? As I mentioned, for you to heal, the biggest thing is we have to decrease inflammation. Inflammation is disease. So we've got to get the inflammation down. Well, how do you do that? How do we do that? If you go to a doctor, what do they do for your inflammation? Anti-inflammatory. Okay, one of those is a steroid, right? That we didn't just pull that off the wall. God made steroids. Just man changed it a little bit, and we have a few more side effects, okay? But vitamin D is a seco-hormone. Vitamin D, if you're having an inflammatory response, your body is using vitamin D. Now for men, it's always also using testosterone. Okay? For women, it's estrogen. You're using some kind of hormone to try to decrease that inflammatory response, and that's why we can't get you to heal unless we bring the inflammation down. We have to do it somehow. Think of a child. A child has, say, autism or some other process like that where there's inflammation going on. What does a child use? They don't have the hormones that an adult does, okay? They're using something. That's why when we give B vitamins, a child up until about 21, 22, they're using 4 times more B vitamins than most of us in this room. They require that. So that kind of gives you a background again on what we're dealing with here. The problem has been that it's hard to measure these things. It's nice. How do you treat something unless you know what you're treating and whether it's working? And that's where that sense review testing, this physiologic testing, comes in, because we can actually see what's going on. I can see in real time dopamine levels, these neurotransmitters that help you feel good. Okay? So, if a person does have one of these neuroimmune problems, what do we do with it? And that's where the best form of any supplement you're going to give is an injection. So if you're low on B12, injection by far. The next is transdermal as far as absorption, because we don't know what the gut's doing. We assume when you take a pill, it's going in. It's not always, especially B12. B12 has to have that intrinsic factor. If you have any bowel problems, for instance, an autistic kid is known to have all kinds of bowel problems. They're not absorbing things. So you're assuming it's getting in there. It's probably not. So it's the shot, the transdermal, sublingual, then oral. Okay, so that's why when you see a lot of these supplements, especially the pharmaceutical grade supplements, they're going to be in those other forms, okay, the transdermal forms. When God made things, he made things in recipes. Okay? You ladies and some of you men who cook, you know what recipes are all about. Okay? Not only do you have the ingredients, but you have it in certain ratios. If those ratios aren't proper, they don't work as well. Right? So that's why when you look at some of these supplements, you'll see them in ratios. And there's all kinds out there. Everybody's getting on the bandwagon now. And so while we're talking about this, classically, a pharmaceutical grade supplement, you'll hear people talk about pharmaceutical grade. A pharmaceutical grade supplement, in the classical sense, isn't just that it's very, very pure. It is about 1 million times purer than what you'll get at the health food store. But it's beyond that. Technically, a pharmaceutical grade, if it says on there 7.5 milligrams, it may have 50 milligrams in it. The 7.5 is what most people absorb. Whereas if you get an over-the-counter at the health food store and it says 7.5, it's 7.5 in that bottle. Do you know that difference? Okay. So there is a huge difference there. And that's why your pharmaceutical grades are going to be more expensive. All right? With this neuroimmune, to try to understand, let's back up a bit again here. You have a sensory organ. Okay, so my hand, I touch something. Okay, so it's sensing. But why do I know I touched anything? It's going from that sensory organ up my nerve to my brain. So you have 3 different parts to this. You have the sensory, you have the nerve, and you have the processing. Okay? When we're trying to figure out some of these syndromes, we have to know where is that problem occurring. In many of these neuroimmune syndromes, it's occurring in the nerve and the sensory organ. Balance, for instance. If I'm standing here before you with my eyes open, I have my vision to see where I am, I have my ears to tell me where I am in space, and I can feel. If I shut my eyes, I'm now using my ears and my feet. If I put you on a foam cushion, I've just taken away this, you can't feel anymore. As long as your eyes are open, you have the eyes and the ears. But if I shut your eyes, suddenly I'm just testing your ears, okay? If all 3 of those systems aren't saying the same thing, you're in trouble. If you ever go to a party, go to church, go somewhere where there's a social gathering, and you're standing there and 3 people come up to you and all 3 are talking at the same time, how do you feel? Think of the nervous system the same way. You got 3 different inputs, the brain's, and they're all saying different things. The brain's saying, who do I listen to? Okay? So it's a simple concept, but we don't think about this. Balance is very, very complex. Very complex. All right? The ophthalmologist, Dr. Chen, I see, the ophthalmologist would like to think it's vision. Well, vision is complex, but not like balance. Okay? Not like balance. So we can use balance to test complex systems in the body and see, are they working right or not? Does that make sense? Okay? So again, getting the inflammation down, and then testing to see what those supplements are doing, see if they're really up where they're supposed to be, and finally being able to test to see, is our treatment actually doing anything, can get us back at least where we're beginning to see some improvement in a lot of people with these syndromes. Okay? We obviously have to treat virus because virus is frequently a problem. And sometimes we will use the supplements to do that. Sometimes we will use the pharmaceuticals. There's always a reason for medication. Okay? But the question is, are you using it appropriately? Okay? There are times when it is very appropriate. It's about the only way that it'll help recover. I'm one of those who, I was trained to use antibiotics copiously. Okay, you heard my story yesterday, I saw all the worst things, and I saw what happened if you didn't keep the infections under control. So I used it a lot. I don't use it as much now, but there's still times when I would use it. Okay? Does that mean it's the only form? No, I think there's lots of other things to do. It's not the topic for today, but there's other things to do. So, are there any questions? Have I kind of made this a little simpler for you? Are we going to take some questions?
Could you explain again?
Wait a second. Let's get you a mic.
Could you explain again how to get a water-soluble vitamin B into the cell?
Okay. So what happens, let's use the example of the folic acid again. Folic acid is water-soluble. To get it across a cell membrane, which is a fatty substance, has lipoproteins on it, to get it in there, it's either got to be actively transported, which means something couples it and brings it in, or you've got to change the substance from water-soluble to fat-soluble. To do that, God put a carbon group on there, a CH3 group, what we call a methyl group. When you put a methyl group on any substance, it now makes it fat-soluble. That process is called methylation. That's why I kept using those terms, methylation. That's a carbon group, a CH3 group. And that then makes it so it can go from a water-soluble to a fat-soluble compartment. And there are enzymes in the body that do that for all these B vitamins. Yes?
Thank you. My question, we got here late, so you may have already covered this, but could you talk about autism, its great increase over the last 10 years, and is it related at all to vaccinations? Thank you.
Well, you really went right for it, didn't you? I could take a poll of this group here and see who I'm going to get in trouble with. This is you know this. This is a hot topic, hot political topic. I will tell you from a medical standpoint, what we are now hearing is herd mentality. Herd mentality means that vaccinations don't work unless you get a certain number of people that are vaccinated. That has never made sense to me. If a vaccination works, a vaccination should work. What difference does it make? Okay? Having said that, their studies show this, okay? The problem with a neuroimmune syndrome like we're dealing with here is that a lot of these people can't fight the virus once you give that vaccination. Now, there are a lot of vaccinations that are dead virus. That's not what we're talking about here. Those vaccinations are a different subject. That's usually not what people are talking about, especially with autism. With autism, we're talking about a live viral vaccine, that MMR vaccine. Okay, that's live viral. Not only that, but it has mercury in it. Now, they now took it out. They put a lower dose. They say it's gone. And that's not true. Okay, there is still mercury in that vaccination from what I've been told. Normally, that wouldn't be a problem. But if you have a child who has a low T cell, that's part of the immune system that fights viruses and cancers. If that T cell is not working well, what is fighting that virus? It's a live virus. If I go and cough on you, you may get a cold. Why? Because I just spread virus to you. It's a live virus, okay? So it's the same thing with a vaccination. You give a live virus, if your immune system is not working, that virus is going to multiply. It's going to explode. And if you have mercury in there, which we know is a neurotoxin, it's going to create problems, okay? Now, why is autism exploding? The interesting thing is, if you look at autism here in the United States, I think it's now 1 in 100, or is it now down to 1 to 30? 1 in 88, thank you. Somewhere down there, okay? It used to be 1 in 1,000. If you look at the same cross-section of kids in Europe, it's 1 in 200. Why? They don't give the vaccination until those kids are older. Okay? So is it the vaccination? Again, remember from yesterday, you have to have the genetic problem. It's this MTHFR, part of it. You have to have that genetic predisposition. It's got to have, the gene has to be turned on. Once it's turned on, those T cells are low. You're not going to fight the virus. And because you don't have methylation, you don't make the glutathione. If you don't make the glutathione, you can't clean out the mercury. Okay? So I think that we're finding a huge explosion of these types of disorders because if you haven't noticed, this world is contaminated. And it's beginning to catch up with us. And as long as we have blinders on like this and say, no, this doesn't exist, we will never get a handle on it. If we get our hands off and say, yeah, maybe this stuff that I always thought wasn't real is real, we might be able to get a handle on some of these things. Another question.
I haven't been tested for the gene, but my sister has, and she has it. She went to you. Is there any side effects on taking this, like on your own? Because I have chronic Lyme disease, and I've been really have to treat myself because no doctor will. Is there any side effects to taking the MTHR,
Taking B vitamins? Is there any side effects?
Yeah, and what would be the dosage, or what is your recommendation?
Well, again, I believe in ratios also. Okay, so it's not just a single. You have to be using all of them. If you give a person a B12 shot all the time, pretty soon it doesn't work anymore. The reason is because you've dropped out the folate. You got to give them together, okay? Yeah, this question's an interesting question because I've had patients come to my office and they've stopped their B vitamins because their doctor has done a blood test and has found that their B12 and folate are sky high and therefore they are, quote, toxic. What did I say about B vitamins? Water soluble. If you get too high with a water soluble vitamin, what happens? You pee it out. So no, there's no side effects. Okay? Yes.
If you have an autoimmune disorder, what can you do to reverse it? Danny says, come to Bella Vita.
Yeah. If you'd asked me this 5 years ago, I'd say, well, you know, what's happened has happened. But in functional medicine circles, we believe that a vast majority of autoimmune diseases are reversible. Some people say curable. That curable word, you know, in medicine we try not to use. That's getting a little bit radical. Most autoimmune disorders are caused by infection initially. Either infection or something going on with the gut. Okay, you look at your autistic kids, they all have gut issues. You look at a lot of other these diseases we're talking about, they have gut issues. So we try to look at, if we're looking at that, we look at the gut initially and see what's going on with the gut. Now, you can't do the standard test that you do the ova and the parasites and send it to the hospital and see, do we have anything? That's worthless. You've got to do a pretty complex test. Genova Diagnostics has been doing these for years and years. There's several other, well, there's 2 labs actually that do this. And they do a pretty good job. In fact, they are so sensitive that they can tell you, they do a DNA swab. They can tell you if you had a parasite go through the bowel. Not that it's in the bowel, but it went through the bowel, maybe in your food or something. They can tell you that. So it's very, very sensitive. And that's where I would start with some of these things. Again, autoimmune, there was a triggering event. Something caused it. Okay? The body didn't just wake up one day and say, oh, I'm going to attack my thyroid. Okay? So let's use autoimmune thyroiditis or Hashimoto's as an example. Most of those patients, the vast majority, have a gluten sensitivity. It's not celiac, but it's gluten. Okay, so that is huge. I used to diagnose that in my practice once every couple months. The other day, I diagnosed 4 in one day. You know, so it's gigantic. It's not celiac. And if you tell a person it's gluten sensitivity, they commonly think it's celiac. It's not. It's a different organism. It's a different bug. It's a different entity, okay? And the problem with something like a gluten sensitivity is once you get what's called a leaky gut, and the gut starts leaking undigested particles across it. Remember, the gut is only a single wall thick. Okay, so we assume that single wall is always staying tight. But once it starts leaking, once it starts opening up from inflammation, if you have gluten sensitivity, you're creating inflammation in there. Once that inflammation occurs, it starts opening up. It'll start leaking other things across. Pretty soon you have all kinds of different food sensitivities. So frequently what we do in the office is we give anti-inflammatories, decrease the inflammatory response, then test for food sensitivities 3-4 months down the road, and you're getting a more accurate picture. Okay? But they can be turned around, yes.
I have a question about ozone therapy.
Ozone therapy?
Yeah, thank you.
What's the question?
Lately, I heard about ozone therapy is good for a lot of things, like parasite or some degenerative disease. So I was told it is good for parasite, and I want to know what you think. Thank you.
Did somebody set her up? That's the other entity I was talking about, ozone therapy. Ozone therapy is very, very controversial. So I will talk about it in what I know about it. The Germans, almost every doctor in Germany uses ozone therapy. Okay? Ozone therapy basically increases the NAD to NADH ratio in the ATP of the mitochondria. Basically what it's doing is increasing energy. So why do we age? Why do we get disease? Why isn't the body working? It all comes down to one thing: energy. And what creates the energy? Oxygen. This goes back to how I started this. Before the flood, we probably had much higher oxygen levels. Okay? It's now been destroyed because the ozone, when at the time of the flood, Institute for Creation Research talks about this. The time of the flood, remember the heavens fell, okay? So we probably had an ozone or a cushion around the earth that increased the atmospheric pressure. So we were breathing more oxygen. That's basically what ozone is. Okay? Now, ozone has a bad rap because when we have smog, we think of ozone. The reason is because ozone has that characteristic smell, and it's easily measured, and so when we go to measure smog, we can measure ozone, and that's how we measure smog. Ozone didn't necessarily cause all that problem. Okay? Do you know who the first practitioner in the United States was who used ozone? First doctor in the United States who used ozone. John Harvey Kellogg. John Harvey Kellogg. Okay? It was used extensively up until the AMA was formed. And you understand, I hope you understand, the AMA does not speak for doctors. Do you understand that? The AMA is a government institution, okay? The AMA would like to think that they're speaking for the common doc. I've never been a member of the AMA, and most docs that I know of are not. All right, so this whole thing you hear on the news about the AMA does this, that, and the other thing, they don't speak for me. Never have. All right, so that whole thing was a vast setup. Do I believe ozone works? Yes. Absolutely. Does it cure Lyme's disease? Yes. Absolutely. It's the only thing that does. Next question.
Yes, my son had a traumatic brain injury 5 years ago when he was 10. And so he had a stroke effect on the right side, left side brain injury. So his hand is better, but still affected, disabled, and a little bit in his foot dystonia. And so I was wondering, how can we know that trauma maybe started this, what you're talking about, or that he's just has residual injury? And then how, if we can know, it can help him.
So she brings up the point that I've been talking about here is, how do you know some of these things? How can you tell what's actually going on here? We can do an MRI, we can do these various things, but it doesn't tell us the function. Whereas that sensor view test will tell us the function. Are those nerves working? Do we have a dopamine problem? Is there something else going on? And that's where I would start. And a single test may not tell us, but if you did a test, then treated, then redid a test, you'd see, are we getting improvement or not? And you'd know.
What test?
Sensory view. Sensory view is the test I talked about yesterday. It's basically adapting balance tests, balance in part of a hearing test that ENT guys have been using forever and ever, but we're looking at it a different way. Okay, so we're interpreting it a different way. But basically with that balance test, I can frequently tell when I do a balance test, I can see if a person had a concussion. And I've seen people that you look and they've had a concussion. I ask them about it. They say, no, I've never hit my head. And you start asking them more and more, and then oh yeah, 15 years ago, I fell on my snowboard, et cetera, and usually you can tell where it was hit. So it's very, very accurate that way, and that helps to pick things up. Next.
Can you speak to us about sugar alcohols? I'm told that like xylitol, erythritol do not affect the blood sugar or promote tooth decay, can even prevent ear infections. Just wondering if it's safe to use.
Yes. Yes. Works very well. Most dentists who are into preventive medicine, that's what they use, is xylitol. Yeah. And it does not affect blood sugar.
Doctor, I got a couple of questions. The SAMe, the S-adenosylmethionine, is it more indicated for antioxidant or depression?
Is it more indicated for antioxidant or depression? We use it classically for depression. Does it have an antioxidant effect? It's not a classic antioxidant effect, no. But it is a methyl donor, okay, which means it does the same thing as what we're talking about here, using the methylfolate and those kinds of things to donate methyl groups in a methylation deficiency. That's why it works.
I guess you're doing general practice. There's a debate on what is a normal blood pressure. And I was taught recently is 105 over 75 is a 1x risk for heart attack. And you go to 125, it's double, 145, it's quadruple, and 165, it's 8 times. So what would you recommend?
Okay, actually, I'm not doing general medicine. I'm doing functional medicine, which is a little bit different key. But blood pressure, it depends on your age. You get down around 100 over 60, 105 over 60, and you're lightheaded. Okay? A 15-year-old can do that, but not you and me. All right? So I see this all the time in my office, where part of the problem with dizziness that I'm seeing is a person who's been on 2-3 different antihypertensives, they're down around 100 over 60, and they're symptomatic. I mean, you get lightheaded if you don't have blood going to your brain. So you got to be careful with those things, depending on age. Okay, I like it. I like blood pressures 120 over 80, something like that. You get below that, especially in an older person, you're too low. You get much above that, and you're running too high. Okay? Yes?
What do you think of the use of Goldman's?
We got a mic back there.
Yesterday you mentioned briefly migraines, headaches, seizures. I've had seizures since I was 3. I've heard that magnesium is good. Can you speak to magnesium and vitamin D and B12 and how that works for seizures?
Well, seizure disorder generally is okay, so nerves are surrounded by fat. Okay? If you have inflammation, you're going to get fluid across that fat layer into the nerve. Now let's take a live electrical wire. As long as it's all sealed up, you can put it in the pool. Okay? But once it starts wearing down, what happens? It starts shorting out. That's what seizures are. Okay? So this whole idea of seizures, it is again the idea that the nerves are not properly being covered in fat. Now, that may be from scarring, who knows? But that's the bottom line on seizures. So that's how these enter into the neuroimmune syndrome is what we're doing is trying to heal those nerves, and they're healed with B vitamins. That's what heals nerves. If you're not getting enough B vitamins, you're not going to heal those nerves. Does that mean we can cure every seizure patient? Absolutely not. Nothing's 100%. But can we help a lot? Yes, we can.
Regarding autoimmune diseases, I've seen in Dr. T. Colin Campbell's book on, what is it? His first book, the main one.
China study?
The China study, yeah. He talks about vitamin D actually in animals reversing autoimmune diseases. And I also know, I'm a dietitian, and I know that lipids, fats, can affect autoimmune disease as well as, autoimmune diseases and inflammation. Mm-hmm. And there's actually other lifestyle factors that can affect inflammation as well. So, you have any comments on?
Yeah, this whole thing of vitamin D is really downplayed in mainstream medicine. And that's why, for a number of you who asked me questions yesterday, I frequently ask, what's your vitamin D level? If you know nothing else about your health, you need to know your vitamin D level. Don't let your doctor tell you it's normal. What is normal? Okay, I want to know the numbers, all right? Because your thyroid doesn't work well if it's below 70, all right? You've got to get the level up. So we use what's called equatorial norm. Equatorial norm is what you would have if you were at the equator, all right? The further north or south you get, the less your vitamin D levels become, because it's a sun hormone, right? So in so many diseases, the vitamin D will affect things. I have a chart that I use in my office. I didn't bring it here. It's a chart of all the tests that have ever been done on vitamin D. And basically what it says, we make the big deal about breast cancer, et cetera, and, we have the pink day with the ribbons and all that kind of stuff. Do you realize that you can cut your breast cancer rates 81% by getting your vitamin D level up to 51? Ladies, do you know what your vitamin D level is? I mean, these are simple things we can do. So you're absolutely right talking about vitamin D. It's a secohormone. It helps decrease inflammatory response. It is the number one thing, next to omega-3s probably, that we deal with in functional medicine.
What do you think of the use of golden seal versus amoxicillin?
For what?
Golden seal.
For what?
Instead
What am I treating?
of amoxicillin to treat whatever.
Whatever?
Colds and,
Well,
usually we are given amoxicillin.
Uh-huh.
But if they tell you you're allergic to amoxicillin, you can't have any more, and you think, oh no, I'm going to die. Well, so then you go to a health food store, and
Okay.
they say, use golden seal, and it works. What do you think?
So what you're asking me is, do I believe in natural medicine? Yes, I do. Do I believe that there's a place for both of them? Yes, I do. If I had an acute tonsillitis, was ready to die, I'd take amoxicillin. I wouldn't use golden seal, okay? But in other circumstances, works great. We should know how to do this stuff. Yes?
I've got a question and a comment. The first comment is, in the movie Fat, Sick, and Nearly Dead, there were two fellas. One lost 60 pounds, the other fellow lost 100 pounds. Both went on juicing. They both had autoimmune problems, and they were both cured. Mm-hmm. The second is that, have you written a book?
Have I written a book? No, I have not written a book. Go ahead.
I want to, since we've been talking about the MTHFR, I actually came to see you. And you put me through a blood test, and I came back with the 677, and I was homozygous, which means I got it from both parents. So the question I have is, can we discuss how you treated me?
Well, that's up to you. We'll discuss.
Because I think they want to know, what do we do about
Do you remember some of your labs?
Yeah, my D was on the lower side.
Give him a microphone again. I want to know what his labs are, so we can talk about this. This is good. Okay, this will give you an idea of what we do to try to figure things out. Yeah, come on up here. Yeah.
Because I had such an incredible transformation. And I have product here, and I'm not trying to make a sale. I'm trying to help people. And this man, God used him in a very remarkable way. But this is why I want to talk about treatment, because it's even non-prescription. It's simple. It's an easy fix, like he said, take vitamin D. So my labs, I don't remember them all, but the T cells were low.
They were low across the board, as I
The
remember.
B12 wasn't even middle of the chart. The D3 was on the lower side.
Okay.
And the folate, I don't remember. And any others I'm not thinking of that. B12, folate, we didn't do a K. Pardon me? K. We didn't do K testing on me. But we did some liver panels and other things. But that's were the indicators. But I also remember what was remarkable when I did the balance test and the eye test. He came back and said, "You have low dopamine." Yeah. And I said, "How do you know that?" You know.
Yeah.
So.
Okay, good. Thank you. Refresh my memory. So he has a 677 homozygous gene. That means he has a 70% reduction in B vitamin deficiency once that gene's turned on. His markers, as I remember it, showed that they were turned on. His T cells weren't even normal. They were below normal across the board. Which means what? He can't fight virus or cancer, correct? So we got to get those T cells up. What makes T cells? B vitamins. Why isn't he making B vitamins? He has that 677 gene where he's got that reduction, okay? How does vitamin D enter into it? It's the same thing. It's a hormone. It helps modulate inflammation. It also is the key to the immune system. If that's low, I don't care what else we do, we got to get that up before anything works. Okay, that's key, right? So with Danny, we started with the Neuro Cream, all right? That's got methyl tetrahydrofolate, it's got methylcobalamin, it's got hydroxycobalamin, it's got pyridoxal 5-phosphate, which is the active form of B6, and it's got some vitamin D in there also, right? We use that as our starting layer. Okay, that's transdermal, okay? I usually start once a week because when I first started doing this, I knew just like you, these are vitamins. Vitamins are not toxic. They're not going to create problems. And I put a businessman flat in bed for a full week, and he was not happy. That's what we call regressive healing. Some people call it a Herxheimer. It's not a true Herxheimer, but it's regressive healing. Some people say over-methylation. That's a false term. But regressive healing is where you actually get the body so ramped up so fast. He didn't have any glutathione. We started giving him, I'm pointing to Danny, I meant that other guy. He didn't have any glutathione. Once I started ramping up the glutathione, he dumped toxins into his system and made him sick, okay? So when I say there's no problems with B vitamins, there is no problem with B vitamins. You just have to be cautious and know what you're doing with them, all right? Anyway, we ramped up by the second week, then we go to twice a day because those B vitamins have a half-life of about 10 hours. And then, because his folic acid level was high, that means that he probably has a blocking antibody. That blocking antibody is usually caused by casein in dairy. That's why those autistic kids have problems with dairy, okay? And because of that high folic acid, then we added the methylfolate plus, which is very, very high levels of methylfolate. It's much higher than regular levels. It's like 4 to 6 times higher. In fact, when Kendall Stewart started doing this years ago, he went to the Texas Medical Board. They called him on the carpet because the neurologists and the pediatricians told him he was poisoning his patients. Now they are treating with twice as much as he's treating. They're over-treating in a lot of ways. They don't need that much, but they don't have the sensor view test to really show what are appropriate levels. So we got to give them credit for at least changing their minds. Okay, yes.
My question regards vitamin B12. If a person is 100% vegan and all body systems working correctly, I understand that our guts have the proper microorganisms in it that will produce vitamin B12 for us. Getting to a point from being ill to that situation, how do you supplement vitamin B12 when, for a vegan, as B12 is an animal product?
Well, that's a good point. But you're not making it in the gut. You're not making enough to maintain the body. And if we were to test a total vegan, frequently they're low. But they're not the only ones that are low. Okay? The ones I see with the lowest B12 levels are full meat eaters. And those are the ones I see primarily in my office. I rarely see vegans. I do occasionally. But you'll hear that it's always, they'll say, oh, the vegans have this problem. It's not. It's across the board. Across the board, we're low in B12. It is true your probiotic, your biotics, the bugs in the gut, those guys do make B12, but it's not enough to be, for most people, to be working well. Your B12 level on a serum test has to be above 500 or there's no B12 in the brain. Okay? So I see this all the time. We have an epidemic of low B12 in my opinion. But your common docs will look at it and kind of cross their eyes. Somebody else? Yeah.
I have a question about trying to change the situation versus constantly maintaining it. Is there a way to reverse the gene mutation, or would you suggest a way to switch the triggers to off versus trying to constantly take enough nutrient to offset it?
Yeah, great comment. You hear what she's saying? Why do we keep doing this if we can just turn the gene off? We don't know how to turn the gene off. We have not been able to turn the gene off, this gene. Now, will we ever get there? Probably, but I can't tell you. I don't know how to do it. Until such time as we can turn it off, we have to keep using this. Where's our next one? Yes.
You said that methylation is needed for the B vitamins to enter the cells. Is there a natural way to create methylation for the B vitamins, or do you have to get them methylated from a health food store or something?
If you don't have the gene turned on, you are methylating it. You do it automatically. That's why most docs say take folic acid, you're fine. Take cyanocobalamin, you're fine. For a number of people, it's fine. But if you've got this abnormality, it's not fine, and that's 30 to 40% of the American population.
So in that case, you would need to take,
You've got to take it.
A methylated B vitamin. Okay.
It's not that you have to. It's just you are a setup. You get in any stressful situations, as we explained yesterday, and you may turn that gene on. Once that gene's on, I don't know how to turn that gene off. All right? Yes?
Yes. Oh, sorry. In order to get those numbers, he wants to go to the doctor and order some blood tests to get your levels on B12, vitamin D, et cetera, One of the most common problem is if you go to your primary and you ask for those, probably they say, well, why you want to know that? You're in good health, this and that. So there's always a resistance. So it's hard for the lay person to keep their health check and balance. Is there any suggestion? Is there any other way to go around this?
Go to a naturopathic doctor. A lot of them have heard of it. Or go to Institute for Functional Medicine. They've heard of it. Go to the American Academy of Environmental... Life Extension magazine also has it, stuff on it. You can go to the website worldhealth.net, where the A4M, the American Academy of Anti-Aging Medicine, most of those docs have heard about this. Basically, you have to go to docs who are into preventive medicine. It's a semi-specialty, just like anything else. You got to go with somebody who knows something about this. You go to your common doc, they're going to... I heard somebody here this weekend talk about going to their Kaiser doctor and they wouldn't do an MTHFR. They didn't think it was necessary. The real problem was he didn't even know what it was. Now, he's not going to tell you that. He's the expert, okay? I mean, there's certain things, you got to figure out on your own here. So, yes.
Will you please, what do you recommend to stop the ringing in the ear?
The ringing in the ear. Okay. So think of this. That's a good example of what we're talking about here, okay? So if I stub my toe, what do I have? What do I feel? Pain. Why do I feel pain? because that nerve is a nerve for pain. It's a nerve for sensation, okay? If I irritate the nerve that you hear with, would you get pain? What would you get? Ringing. Okay, it's an irritation of the nerve that goes to the ear. Okay, so it's just telling me you got irritation like that. Something's causing it. Frequently it's a virus, okay, but it could be a B12 deficiency. Now zinc will also do it, and that was the classic that I was taught in school, is it's zinc. And I found that years and years I was pretty aggressive with these things, and I found in women it never worked, and in men it worked 10 to 15% of the time. That's pretty low in my book, okay? And more recently, I've been using high doses B12. Pretty good. So again, I'm saying I think we have much lower B12 levels than we recognize. So in the back there.
Is there a benefit to methylcobalamin over cyanocobalamin?
Yeah, do you know where cyanocobalamin comes from?
No?
Cyanide. Does that ring a bell?
Yes. That's the cyan part of it. Next question
that's
is...
the cyano, yes.
Okay, do you recommend then that they get the methylcobalamin?
I recommend it to people who have this problem. Does everybody need methylcobalamin? Probably not. Probably not, because they can take care of that cyanide molecule and get rid of it because they got glutathione.
Do the bacteria around your teeth, if you brush your teeth with plain water and swallow it before you start brushing your teeth with toothpaste, does this make a difference? I've been told it does.
Yes. Yeah, most of our diseases in the body, including atherosclerosis, are coming from our teeth. They talked about that yesterday a little bit, touched on it. And in fact, I'll go further than that. We can tell what disease you're going to get by which tooth is infected. Okay? So, and a lot of this stuff is, we've been thinking is Eastern mysticism kind of, hey, there are certain, your teeth are lined up with certain other organs in the body, and yeah, it makes a huge difference. If you have rotten teeth, get rid of them. It's not helping your health at all. So we look for 3 different places for infection. See, if we have inflammation is being caused by something. Most of the time it's infection, so you got to look in the bowel, number 1. That's the number 1 place. The second place is the teeth. The third place are the sinuses. Okay, so these are very close to my original haunting grounds, okay, my hunting grounds in the sinuses. So you got to look at all those kinds of things. Okay, yes?
So you're just about answering my question here in regards to inflammation. Could you tell me some natural ways of lowering inflammation, generally speaking?
Well, you're already doing the best natural ways, plant-based diet. That's the number 1 way, okay? What other? Well, the omegas will do that. I'm thinking of anything else like, turmeric, some of these kinds of things that actually act on the body to neutralize the system, because it's an activation of that immune system. Something's ramping that immune system up. We've got to bring that down, okay? So any of those that people have talked about here work well. Garlic works well, sure. Lots of water. Yeah, I mean, we're already halfway there. That's why I'm saying it. We're already on the right track in this room. It's just, what else do we do? Because some of us are still sick. What else do we do beyond this? Okay? I've had a number of you come up. I've been doing this, everything you're doing right, but you're still not. Okay, part of that is sin. I'm sorry. Part of that is the earth is waxing old like a garment. We're not going to change it. But some of the stuff we can turn around. And it's energy, again, remember? The body is fading out, and we need to get those energy sources back up. Yes?
Turning on my mic. Thank you so much for mentioning the, one of the biggest things for the gut that we like to use is the omegas, the barleans, because it does stop inflammation. In fact, they say it's as beneficial as Motrin when somebody is in like a muscle issue. But since everybody wants to know levels, you mentioned, what levels do you like to see for B12, folate, and vitamin D? for somebody that is in an inflammatory response?
Okay, so normal folate levels are 8 to 12. Anything above 15 is too high. B12, there is really no good serum level of B12. As I said, if it's low, I know you're low. If it's high, you're probably low also. Okay? I like to see it at least above 500. But again, there's certain labs, okay, let me back up. There's certain labs I think that are really key, this vitamin D above 70, et cetera, that gives me an idea. But don't treat the lab. Okay, that's what we docs are taught to do, treat the lab. You don't want to treat the lab, I'm treating you. Okay, I don't care what your lab level shows. If everything else is telling me that you're hypothyroid till proven otherwise. I don't care what that lab shows. Now that is heresy in medicine today, but that's where functional medicine is going, okay? And that's why I'm seeing a ton of thyroid patients, all right? Because everybody knows they have a problem. So what was the other one you asked about? B12, folate, D above 70. Yeah, yes. Yes.
I have a question about the chronic fatigue and the cytomegalovirus. I'd like to know if you think they're curable.
Yes.
Reversible or curable?
Well, okay, that's the same thing that we talked about before, curable. Okay, so I won't say curable, they're reversible. But if you have no symptoms, do you care? Okay. I mean, we're talking semantics here, so yeah. We'll talk later. Okay, yes.
What do you recommend for somebody who has depression to reverse it?
I think a combination approach would work great. I think that Neil Nedley's depression workshop is excellent. I think a lot of people with depression, however, have this problem with the methylation going on, and I think a combination of those two is dynamite. Now, he has excellent results just with doing what he's doing. So but I have some patients who have not done as well, and I think the reason is because we have not used the methylation key. So I think that combination is perfect, and we have it in Adventism. We should be doing these things. Yes. Where? Oh, here.
Yeah.
Sorry.
My daughter was tested heterozygote. So is the treatment the same?
Heterozygous for which?
For the Mthfr.
1298 or 677?
I think it was 677.
677. Okay.
So is the treatment the same? Would I do the cream like twice a day, once a day, and then twice? No, I'm serious. Once a week, right? Mm-hmm. And then twice a week, and just keep it twice a week.
Yeah, once a day for a week, then twice a day the next week. And depending on her folate level, we may add methylfolate plus. Okay, that's why you need to get those levels to know.
Mm-hmm. Okay.
Now who? Yes.
Back to vitamin D. Now, somebody with a compromised thyroid, how are you going to get those levels back up without having a functioning thyroid?
How are we going to get what levels back up?
Vitamin D levels. How are we going to?
Vitamin D is all on its own. It has nothing to do with the thyroid. Vitamin D is just a receptor for. If you have thyroid kicks out T4. T4 is inactive. T4 has to convert to T3 using selenium, zinc, iodine, no stress, no heavy metals. Then it'll go to an active thyroid. So now you have T3 floating around in the blood. It does nothing in the blood. It has to bind to a cell. So it goes to bind to a cell. It's vitamin D that helps that bind. Then you have to have iron to help take it into the cell. It's a very, very complex mechanism. So vitamin D itself has nothing to do with, it's not dependent on thyroid, okay? But thyroid is dependent on vitamin D to actually get it to work, to bind.
That was my question. How do you make the thyroid be able to utilize the vitamin D?
It will.
But she doesn't have her thyroid.
Well, then you need to treat the thyroid. If she doesn't have enough thyroid, she needs to treat the thyroid.
Well, it's been killed by radiation.
Doesn't matter, you'd give thyroid. That's where medication is essential. Yes.
Is there any way of reversing or stopping the symptoms of hyperacusis?
Hyperacusis. Do you know what hyperacusis is? No. It's where you are standing there and somebody hits, something that has a little ring to it or a little ding, and you hear it. It's way hyper exaggerated. That's a nerve problem again. Okay? See, I was taught in ENT that if your hearing starts dropping, okay, that's the reason you get ringing in the ears. That's the reason you get hyperacusis, all this kind of stuff. What I've learned is that, no, it's at a nerve level, all right? Your nerves are singing. If I did an otoacoustic on you or an acoustic reflex, I could see it singing. Okay, instead of responding at 85 to 90, you'd be responding at 50, which means it's hypersensitive. Something's irritating that nerve. How do you do it? Same thing we've been talking about. Same thing. That's why this is right down ENT lines. Yes?
Can you get headaches from the MTHFR?
Can you get, you mean does it cause headaches?
Yeah, does it cause
Yes.
headaches?
Yes.
What
We're
would I
talking about
need?
migraines?
Yeah, and just, because I get frequent headaches.
Hormonal will do it also.
Okay.
A lot of these things that you're talking to me about, yes, this will do it, but it's not the only cause. Okay, there's numerous causes here, so I'm trying to balance.
I have a question
Okay, yes.
about sinuses. My ears stop up for a long time, like if I go up over a hill. And recently I had a cold, and after the cold, I really lost a lot of sense of my smell. And so I was wondering what could be done about that.
Did you lose it all or just most of it?
Just, I used to be able to smell when I walked in the house if the house cleaner had used bleach. It would drive me crazy. Now I can use bleach and it doesn't even bother me.
Can you still taste?
Yes.
Okay. So you had a viral, and that virus affected the nerve, and in the olden days we would say that's permanent. Nowadays I have one patient that we're treating with the O3, and they're getting their smell back. Another one? Who's next? Okay. You.
Okay, there was a group of us that did a depression seminar, Neil Nedley depression seminar in Grants Pass.
Good.
And the first thing we did was introduce them to the concept of Himalayan salt in the Soleil, and we gave everybody a little bit to take home. And by the end, people were using it every single day, and they were telling us that was the best thing that they learned in the seminar. Tried to share it with Neil Nedley and got no response, but people need to know that.
And what's in the Himalayan salt that
It's,
does it?
it's full spectrum salt. It's actually it's reconstituted Noah's floodwater.
It's actually the magnesium in there that most works best in that. And basically it's a relaxant. And most of it's the number one deficiency we have as far as minerals is magnesium.
And I've, in my own working with people, we talked about epilepsy. I've had experience where I just put a little bit of magnesium on people's lips, just touch their lips with a little bit of liquid magnesium. And I've seen numerous times where a seizure will instantly stop right there, dead in its tracks. So I don't know how many people know that in the world, but it seems like that's worth passing on. And
Good point.
Another thing I wanted to share is there's a little add-on to the computer that is becoming much more popular. It's called a quantum analyzer. And you can test a lot of things in your own home. It's a totally non-invasive test. People should know about these things.
Okay, good, thank you.
You can ask me about it.
Next.
Sunshine on the skin help handle enough vitamin D to handle the thyroid problem.
If you're at the equator, yes.
But I mean, I'm in Redding,
No.
so I walk and I try to expose my skin.
Yeah, okay, so when I first heard about this about 8-9 years ago in a lecture, they said if your practice is north of Santa Barbara, 60% of your patients would be low in vitamin D. Okay? I have found in Mount Shasta, which is only an hour north of you, And we get about the same sun, 300 days a year of sun. I've found that fully 90% of my patients are low, and I have some patients down in the single digit, okay? The reason is you can stand, a certain 5 months out of the year, you can stand outside totally naked. You're not getting any vitamin D. That sun is too far south to make vitamin D. It doesn't work.
Does that mean I need to take vitamin D in a pill?
That's up to you, but you're not going to get it. Either that or you have to move to the equator. Or take a chance that you're going to be okay. Remember, the vitamin D is the basis of the immune system, so. Yes?
I've heard that noni juice helps with constipation. Can you comment on that?
Yes, and so does thyroid. If you're doing everything else, plant-based diet, and still have constipation, check your thyroid.
But the noni juice, if you take that, will that help with constipation?
Yeah, any juice will.
Okay.
Okay, more fiber will too. But we're looking for underlying causes. Don't look outside some of those other things. Yeah.
Would you say that noni juice on the whole, just taken if you don't have constipation, is a good thing?
I have no idea. I know that a lot of people talk about noni juice as having, all kinds of properties. I'm not the one to speak to that. I don't know. Yes.
It seems like the culprit or the cause of a lot of the autoimmune and the different dysfunctions is from viral, and you did state that also, and I'm wondering how to get virus out of the nerves.
There's no way to get virus out of the nerves that I'm aware of. What we have to do is control it. So as long as your immune system is working with those T cells and all that, your virus is controlled. Now, you can stop replication of virus with monolaurin and some of those other herbal ingredients, but whether it's really killing the virus totally is another question. That's why we get, we've had chicken pox, a lot of us, that's why we get the shingles. Okay, the virus never went away. It's there in the nerve. It's ready when your immune system drops, boom, it blossoms. Okay, so a lot of these things we don't have answers for. Someday I'm going to ask that great maker all about it and see if he can answer some of these things. But until that time, we have to make do with what we have. And that's why it's important to, if you need to once a year, come back here, get yourself all juiced back up about the fact that you're doing the right thing. You need to keep going in this direction. Plant-based diet is definitely the way to go. Amen. Don't forget your exercise. And your connection with God, exactly. A lot of this stuff makes no difference if you don't know who you're serving. Okay, so remember that connection also. Thank you.